Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
You've probably heard about the power of hormones, and there's a reason why. We know that hormones are our body's chemical messengers, and they are incredibly powerful, meaning that it only takes a tiny little amount to cause big changes or fluctuations within the way that our body actually is functioning. And the way that hormones work is they travel in our bloodstream to different tissues and organs, and they work over time, and they affect so many different aspects of the way that our body works. When we look at our metabolism, when you look at reproduction, when you look at your mood, when you look at sexual function, growth and development, and this is all driven by the different endocrine glands, which is going to be the primary source for which the hormones are secreted from. So we have things such as the pituitary gland, the pineal gland, we have the thymus, the thyroid, the adrenals, the pancreas, for example. And then in men, we utilize the testes, and in women, we are looking at the ovaries, which is what I wanted to focus on today, which is PCOS, which is polycystic ovarian syndrome. And this is much more common than many women even realize. And many women come to us and say, what nutrients should I be taking? Or what diet should I adhere to when it comes to this condition? I've gone to my doctor. They told me I have PCOS. What can I be doing? So I want to talk about that in some detail today. So I am Amanda Williams, MD, MPH, and hormones are a driving force for so many things in our body. And I mean, you can look at the thyroid, for example. We know if someone has a overactive or an underactive thyroid, this can create issues. We know that when people have high amounts of adrenal stress, then you're going to be releasing excess amount of the hormone cortisol. We know that in the pancreas, when the hormone insulin is not working properly, then we can have problems such as metabolic syndrome and diabetes. But then in the setting of PCOS, this is a hormonal metabolic disorder that causes a variety of different presenting symptoms, such as irregular menstrual cycles, ovarian cysts. Some women will actually develop facial hair, and we can look at issues such as insulin resistance as well. So you can see how the hormones are driving all of this. You look at irregular menstrual cycle. Clearly, we know that that's hormonally driven. You can look at the development of ovarian cysts. Once again, we know that hormones are that underlying issue. So when we look at the statistical amount of women who actually are suffering from PCOS, it is really quite profound. And we can roughly state that here in the United States, it's somewhere around 10% of women have PCOS, and it's one of the most common causes of female infertility. Now, when we look at just that amount right there, 10% of women are struggling with this hormonal condition. And we see the resulting problems because oftentimes women who have PCOS can then develop other serious health issues, such as diabetes, brought on because of that insulin resistance. Certainly, if they do find that they get pregnant, then gestational diabetes can be an issue. We see a correlation between an increased risk of heart disease. And why is that? We can look at that estrogen pathway. We can look at high blood pressure, so hypertension, so damage to the vascular system. Certainly, we know other factors can be tied in with those hormonal disruptions, including sleep apnea, as well as a higher association to things such as depression and anxiety. So we know that this is a problem. We know that many women clearly are dealing with this. If we say 10% of women of childbearing age in this country have PCOS, then that's an awful lot of women. And we can look and see, what they should be doing. Because, one of the first things is to obviously screen and do comprehensive blood testing. Looking at fasting insulin is really, really important. Looking at free and total testosterone levels, also incredibly important. And looking at those cardiovascular risk factors are also incredibly important. Even if that's at minimum, looking at cholesterol, these are things that need to be done. Now, we do realize that the standard American diet, which is high in bad carbohydrates and saturated fats, certainly are going to be a driving force to making PCOS worse. So the best choice is going to be the Mediterranean diet for women who have PCOS. So kind of falls into that big loop of doesn't matter what condition you have, Mediterranean diet is always going to be your number one choice. So we know that this is going to incorporate a lot of those high antioxidant foods that are coming from fruits and vegetables. You're going to get much more balance when it comes to your carbohydrate intake, the good healthy fats that help to offset and ease inflammation in the body. This is why the adherence to that diet for women with PCOS is incredibly important. And then, of course, we have to look at physical activity and understanding that regular exercise, even if that's walking on a daily basis for 20, 30 minutes, this can help to improve insulin sensitivity. And at the end of the day, that's what we're aiming for. We want to make sure that the pancreas, remember that endocrine gland that's secreting out that insulin, is working the way we need it to. And that physical activity will help to assist with that. Now, we can also look at traditional treatments and what most women, if they go in and they see their physician and they're dealing with all of these problems. And PCOS, by the way, too, can be incredibly painful because if a woman gets ovarian cysts, this can lead to extreme discomfort during their menstrual cycle. And some of them just have irregular cycles as it is. So, they may not be having a traditional normal 28-day cycle each and every single month. So generally speaking, doctors look towards things like metformin. Different surgeries are always options for women. And when we're talking about surgeries, we're talking about, going in and the removal of those ovarian cysts. But they generally don't look at the other factors. They don't look at the activity. They don't look at the diet. They don't look at, what they can be doing to enhance their body's ability to process these hormones and try to regulate those endocrine glands in a much more optimal way. And this is why we look at things such as chromium, N-acetylcysteine, for example. We know NAC is so incredibly important for allowing the body to manufacture glutathione, but we also recognize that NAC helps to improve upon insulin sensitivity. And for many women who fall into that category of having problems with fertility, when they take NAC, this can really be beneficial. And they have actually done studies where they give women who are struggling with getting pregnant N-acetylcysteine, and the next thing you know, a lot of their issues go away. Why is that? Because we're getting better regulation in terms of that hormonal control. So we have all of these different factors that kind of come together. And we know that we want to minimize those risks because if left untreated, women who have PCOS have that much greater likelihood of developing severe clinical manifestations. So we're looking at that higher risk of cardiovascular disease, even endometrial cancers. So these are the reasons why we want to make sure that PCOS is addressed across all fronts: diet, exercise, and nutrients. Now, traditional mainstream medicine, like I said, always overlooks that, and they don't look at the relevant role of the foods that maybe a woman who has PCOS is eating every day and why that's making her insulin resistance worse, which at the end of the day is making the PCOS worse. So this is why I wanted to talk about this. And we know from so many of the published clinical studies out there that the utilization of natural nutrients, things like NAC, for example, and chromium, can do so much to help create this balance. So if you've been diagnosed with PCOS, then you should be taking these different steps. You should be changing up your diet. You should be finding ways to become more physically active. You should, of course, always be going in and looking at those hormone levels, looking at your free and total testosterone, looking at that fasting insulin. You need to know if what you're doing is working, or do you still need to make additional modifications? And all of this is really very relevant because when you look at fertility and infertility in this country, this has been like a steady tick. You see more and more cases of infertility. It's on the rise in this country, but we also see a strong correlation between metabolic syndrome and type 2 diabetes on the rise and obesity. Well, we can link PCOS in that grouping. We know that the obesity crisis in this country is directly correlated with PCOS. Now, does this mean that a woman who is, thin cannot have PCOS? No, definitely not. And many times it's overlooked because sometimes you will have a doctor that says, well, they should be overweight, they should have a blood sugar issue, and maybe some facial hair. And then I know it's PCOS. And you could, like I said, have a woman who is within normal weight or even underweight who can still have this issue. Because remember, what we're dealing with is those chemical messengers. And it's once one gets screwed up, it kind of works like a forest fire and the rest of them start to get screwed up. And this is the point about hormones that's so relevant because many times people forget that. Like if you have someone who has thyroid dysfunction and then the next thing you know, they're having a problem with their sleep and they don't ever correlate that the adrenal stress and their thyroid dysfunction is now affecting the next set of hormones. So this is why it's really important to, know as much as you can about your actual hormone status. And this is an area that I do think for even modern medicine, they just don't look at those hormone levels enough, even though we know that this is hormone dependent. This is driven because of hormones. So I definitely like to always encourage people, make sure you get comprehensive hormone testing. Now, there's also something that's this is just kind of a offshoot because I've had women ask me about this. Sometimes when women have PCOS, they actually get a hyperpigmentation of the skin. And oftentimes it's on the neck, maybe in the inner thighs, in the armpits. And this is a classic sign of insulin resistance. And it is due to that higher circulating glucose and insulin level. So, that is one key kind of giveaway. If you see that hyperpigmentation that is occurring along with abnormal menstrual cycle, then we can look and say, okay, we've got clear symptoms. Now we need to really look at those hormones. So, but in that event, definitely look at things such as vitamin C serum. Very, very beneficial when it comes to maintaining the proper pigmentation, and the power of that antioxidant contained within the vitamin C serum is really, really important. So, first and foremost, make sure you have all those hormone levels tested. Look at your DHEA level. That's so critical as well. So it's not just looking at estrogen. You have to look at estradiol. You have to look at free and total testosterone. You have to look at the thyroid. We have to look at all of them. We have to look at that fasting insulin. We want to see what's going on with the cholesterol, with the triglycerides, because this can all be directly correlated with that insulin resistance. So we know all of these different things. And then we say to ourselves, how do we fix it? What are the steps that we can take? Well, we can clean up our diet. That's first and foremost. We can start to have a much better adherence to that Mediterranean diet. We can start to get ourselves onto a regular exercise cycle. Maybe you just commit yourself starting off 3 days a week, half an hour a day that you're going to walk. And then you increase that to 5 days a week. The next thing you know, you're going to be walking every single day because it's part of your routine. Remember, everything in life becomes routine. It's kind of like when you have a job. You get up, you do your morning routine, you get in your car, you drive to the office, you do your work, you get back in your car, you drive home. Everything in our lives revolve around routines. So when we're changing things in terms of our diet and our exercise, we have to stick with it so it becomes routine. And then it doesn't become a task or a chore. It just becomes part of what we do each and every single day. So Obviously, you would want to make sure that we get the menstrual cycle regulated. And so obviously women would be working with their OBGYNs in terms of any, hormone aspects to that they may have to deal with. We're not dealing with that here at Invite. What we are looking at is how do we try to create more balance in all of those endocrine glands? How is it that we can better support our insulin? And so we look at things such as chromium. For example, we know that chromium is a trace mineral, but it is incredibly, incredibly important when it comes to enhancing insulin sensitivity. And we know that there is this strong correlation between chromium and glucose metabolism. So if we start to take chromium, even if it's 200 micrograms per day, this can help to allow the body to better respond to rises in glucose, meaning that the insulin will be much more responsive as well. Then we can also look at NAC, which I had mentioned. And NAC certainly has been studied in the setting of PCOS. And we know that there is a large body of evidence that supports the use of N-acetylcysteine in women with PCOS, not only for addressing the issue with insulin resistance. So the NAC will help to improve upon insulin sensitivity, meaning that the blood sugar is not going to stay high, and we're not going to have as many of those blunted effects that occur, such as glycation, which does damage to blood vessels, which increases our risk for cardiovascular events. But we also know that the NAC is widely looked at and has been studied and has relevance when it comes to restoring fertility. And we know that the infertility is one of the biggest problems in the women who have PCOS. So hence, we fall back to our NAC. How much should you be utilizing? I would say a woman who has has PCOS would want to ideally be taking probably at minimum 1,200 milligrams of NAC per day, maybe in a divided dose. Take that with food. And then we look at magnesium, because we know that most Americans are deficient or insufficient in magnesium. And we know that magnesium plays a really relevant role in stopping that progression of insulin resistance. And so if we want to try to avoid type 2 diabetes, we want to avoid that heart disease, making sure that we have magnesium on board is incredibly important in that setting of PCOS. So this is why the magnesium becomes part of that protocol as well. Then we can look at just the basics that you should be taking anyways, things like vitamin D, and recognizing that many women who have PCOS have low serum levels of vitamin D. So if we can get our vitamin D levels back to a healthier range, many times this helps to regulate all of those different endocrine hormones. Because remember, vitamin D itself is technically a hormone. And then we have things like omega-3 fatty acids. Those are so important. You should be taking them anyways, but we need to be able to ease inflammation. And we know that our things like fish oil, flaxseed are so important when it comes to being able to do that. Now we can also look at things such as green tea extract. And green tea has been looked at and has a value when we look at PCOS. And we know that green tea has this positive effect on glucose metabolism, which is why when they've given green tea extract to women who have PCOS, not only do they see an improvement in their hemoglobin A1C levels and their fasting glucose, but they also see a lowering of systemic inflammation in things such as TNF alpha, which is tumor necrosis factor alpha. So all of these things are very, very relevant, and we should not overlook them. So we know the different things that we need to do. We know we need to change up our diet. We know we need to include more exercise. We need to have our omega-3s, our vitamin D, our magnesium, some chromium, NAC for sure. And we can also add in a little bit of green tea extract. And this should give you a more balanced approach to allowing your endocrine glands to do what we need them to do and not let those hormones run amok in the body. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Do make sure you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.